Hey guys, tonight we begin with a story about ambition, chemistry, and one pharmaceutical company's oddly noble quest to build an amphetamine you supposedly could not abuse. That's right, tonight we're drifting into the strange and fascinating history of Vyvanse, the little capsule that Big Pharma designed to be smarter than the people trying to misuse it. Before we start, a warm and sincere thank you to the listener who suggested this topic. Your ideas genuinely shape what happens on this channel, and this one was far too good to pass up. If you enjoy these slow, late-night journeys through history, feel free to like the video and subscribe, but only if you actually enjoy what I do here. Leave a comment telling me where you're listening from and what time it is for you, because somehow it is always the middle of the night somewhere. And if you would rather drift off with just your ears, the channel is now on Spotify too, with a link waiting patiently in the description. Now dim the lights, switch on a fan for that soft background hum, get comfortable, and let your shoulders sink into the mattress. Let's pause for a moment and wonder together. Have you ever asked why one amphetamine ends up in a child's morning routine and another ends up crushed on a nightclub bathroom counter? Have you ever wondered whether a drug can truly be engineered to resist its own misuse, or whether that is just a marketing brochure wearing a lab coat? Could a company actually outsmart human nature with chemistry? Or is that a bit like child-proofing a cookie jar and expecting the raccoons to simply give up and go home? And how does a molecule invented in a quiet office park in rural Virginia end up earning billions of dollars and reshaping the way the entire world medicates attention itself? Well, tonight you are going to find out. Congratulations. You've just woken up in the early 2000s, somewhere inside a fluorescent-lit research lab, where a small team of scientists is staring at a whiteboard, trying to solve a problem the rest of the pharmaceutical industry had quietly decided was unsolvable. There is stale coffee going cold in paper cups, there is a whiteboard covered in molecules, and there is one very ambitious idea taking shape. Welcome to the birth of the abuse-proof amphetamine. Before Vyvanse existed, the pharmaceutical world had a quiet, uncomfortable secret sitting right on the pharmacy shelf. Amphetamines worked. They genuinely helped millions of people focus, function, and get through the day. But they also had a habit of escaping the medicine cabinet and turning up in places no doctor ever intended. The same little pills prescribed to a distracted 9-year-old could be crushed, snorted, dissolved, or sold in a dorm room hallway for the price of a pizza. And for decades the accepted wisdom was that this was simply the cost of doing business. You could not have the medicine without the mischief. The molecule did not care whether it was helping or being abused, it just did its job. And that, it turned out, was a problem worth billions of dollars to anyone brave or foolish enough to try to fix it. Think about it for a moment the way an executive in a boardroom might have thought about it. Here was a drug class that treated a real, diagnosable condition, backed by decades of research and millions of satisfied patients. And yet every single formulation carried the same asterisk. A determined teenager with a pill and a textbook could undo years of careful pharmaceutical engineering in about 11 seconds. It was a bit like building an elaborate vault door for your house, and then discovering the whole wall around it was made of drywall. The vault worked beautifully, right up until somebody simply walked around it. Doctors were caught in an uncomfortable position too. They wanted to help patients who genuinely needed the medication, yet every prescription pad came with a quiet awareness that somewhere down the line, some portion of those pills would not end up where they were supposed to. Parents worried about medicine cabinets. School nurses worried about backpacks. Insurance companies worried about liability. And regulators, who had already lived through one very public amphetamine panic in the middle of the 20th century, were in no mood to be embarrassed twice by the same chemical family. What made the problem so stubborn was not a lack of trying. Companies had spent years designing slower release beads, protective coatings, and clever capsule architecture meant to spread the medicine gradually across the day. Extended release formulations were the pharmaceutical equivalent of a crock pot, meant to let the medicine simmer gently rather than blast through all at once. The trouble was that nearly all of these designs depended on the outside packaging staying intact. Crush the bead, and the whole slow-release plan evaporated instantly, leaving nothing but the raw, fast-acting drug underneath. It was an engineering solution built entirely around good behaviour, which is a wonderful design principle right up until somebody with a coffee grinder gets involved. So the industry sat with this uncomfortable tension for years. Everybody knew stimulant medications were valuable. Everybody also knew they were routinely diverted, misused, and shared in ways that had nothing to do with a doctor's original intention. Surveys of college campuses kept turning up the same story. Students without prescriptions borrowing, buying, or simply taking a friend's pills before exams, treating a Schedule II controlled substance with roughly the same casualness as a cup of coffee. It was an open secret with real consequences, and nobody in the big glossy pharmaceutical towers had found a way to make the molecule itself behave differently no matter who was holding it. What the industry needed was not another coating, another bead, or another clever capsule shape. All of those approaches still handed over an active, ready-to-work drug and simply hoped the packaging would slow someone down. What was needed instead was something stranger and more fundamental, a version of the drug that was not merely difficult to access quickly, but one that was, at the chemical level, incapable of working quickly no matter what you did to it physically. Nobody quite knew how to build that yet. But somewhere out there, a small team of unglamorous patient scientists were about to spend years trying, and their answer would end up rewriting an entire chapter of pharmaceutical history. It is worth sitting for a moment with how unusual this challenge actually was, because most pharmaceutical problems get solved by making the good effect stronger. This one required the opposite instinct entirely, deliberately dulling the drug's most exciting properties without dulling its usefulness one bit. That is a strange kind of tightrope to walk, a bit like trying to make a firework that still lights up the night sky beautifully, but absolutely refuses to explode if a curious child happens to pick it up and shake it. Most engineers would call that combination impossible. A small handful of stubborn chemists were about to disagree, quietly, patiently, one whiteboard sketch at a time, in an office park that nobody outside their own small industry had ever bothered to notice. To understand why anyone wanted an abuse-proof amphetamine, you first have to understand just how long amphetamine had been causing trouble. This was not some new invention. Amphetamine had been synthesized back in the 1880s and rediscovered in the 1920s and 30s, when it was marketed with breathtaking confidence for everything from stuffy noses to low moods to fatigue. Soldiers took it, students took it, housewives took it, and truck drivers practically ran on it. It was the wonder chemical of the 20th century, right up until everyone realized the wonder came with a very sharp hook. By the time the modern era arrived, amphetamine had a century of baggage trailing behind it like a very tired, very jittery ghost, and the industry was still trying to figure out how to keep the good parts while quietly ushering the bad parts out the back door. The molecule itself was first pulled together by a young Romanian chemist working on his doctorate in Germany in the 1880s. At the time, he had no idea what he had actually made. He was chasing something else entirely, some obscure branch of chemistry unrelated to stimulating the human nervous system, and he simply filed the compound away as an interesting but useless curiosity. It sat quietly on a shelf of forgotten discoveries for roughly 4 decades, patiently waiting for someone to notice what it could actually do to a human brain. That someone eventually arrived in the late 1920s, a chemist searching for a better decongestant of all things. He was trying to improve on an existing plant-derived remedy, and stumbled instead onto a compound with an entirely different personality. It cleared your sinuses, yes, but it also made your heart race, your mind sharpen, and your fatigue evaporate as if someone had quietly unplugged it. By the early 1930s, this discovery had been packaged into an over-the-counter inhaler, sold cheerfully on pharmacy shelves as a simple remedy for a stuffy nose. Nobody quite understood yet what they were really selling. Within just a handful of years, people figured out that the little medicated strip tucked inside those inhalers could be pulled out, dropped into a cup of coffee, and chewed or swallowed for an entirely different kind of relief. College students used it to cram for exams. Soldiers were handed it during the Second World War to stay alert through impossibly long missions in cockpits and trenches. It became, quite literally, a wonder drug, prescribed for depression, for narcolepsy, for weight loss, for practically anything a doctor could imagine treating with a jolt of energy and false optimism. And then, inevitably, came the reckoning. By the later decades of the century, amphetamine had cycled through phases of celebration, mass distribution, and eventually alarm, as doctors and regulators noticed the same pattern repeating everywhere it went. People started needing more to feel the same effect. People started chasing the feeling itself rather than the original medical reason for taking it. Entire waves of amphetamine misuse rippled through different decades and different countries, each one leaving behind a slightly more cautious, slightly more regulated version of the drug than before. By the time the 21st century rolled around, amphetamine had already lived an entire complicated lifetime, celebrated, restricted, glamorized, criminalized, and medicalized, sometimes all within the same 10-year stretch. Whoever was going to build the next chapter of this molecule's story was inheriting a very long, very complicated shadow, and they knew it. Picture for a moment the sheer strangeness of a chemical compound living several entirely separate lives across a single century, each one almost unrecognizable from the last. First, an obscure laboratory curiosity nobody bothered to name properly. Then a miracle decongestant sold cheerfully over the counter. Then a wartime tool handed to exhausted pilots and soldiers with barely a second thought. Then a college dorm room shortcut. Then a public health scare. Then a tightly regulated medical treatment hemmed in by scheduling laws and careful prescribing guidelines. Very few molecules get to wear that many different hats across their lifetime, and even fewer manage to keep circling back into relevance decade after decade. Amphetamine was not a passing trend. It was closer to a recurring character in the story of modern medicine, one that kept returning to the stage wearing a slightly different costume each time. By the 1990s and early 2000s, one name dominated the world of prescription stimulants, and that name was Adderall. It was a clever mixture of 4 different amphetamine salts, and it became the default answer to attention problems in classrooms and offices across an entire continent. Adderall was effective, it was everywhere, and it made an enormous amount of money for its makers. But Adderall had 2 problems it could never quite shake. The first was that it was immediately active the moment it hit your system, which made it easy to misuse. The second was more of a boardroom nightmare than a medical one. Its most profitable patents were quietly ticking toward expiration, and when those patents fell, cheaper copies would come flooding in. The empire was thriving, but somewhere in the distance the clock was already counting down. Picture the sheer scale of it for a moment. By the time attention deficit diagnoses climbed steadily through the 90s and into the new millennium, doctors everywhere were reaching for the same orange bottle. Parents whispered its name in school pickup lines. College students whispered its name in dorm hallways for entirely different reasons. It became so deeply woven into daily American life that its brand name occasionally slipped into casual conversation the way people might mention a well-known soft drink, which is an unusual kind of fame for a Schedule II controlled substance to achieve. Underneath that success, though, sat the exact same architecture that had defined amphetamine products for decades. The active drug in Adderall was ready to work the instant it dissolved in your stomach. Manufacturers built extended release versions with clever little time delay beads, meant to release medication steadily throughout the day, an elegant solution on paper. But elegance only survives contact with a mortar and pestle for so long. Crush the capsule, and every one of those carefully engineered delay beads simply gave up its secrets all at once, delivering a fast, blunt rush instead of the smooth curve doctors had intended. Meanwhile, in the quiet, unglamorous back offices where pharmaceutical executives actually spend their days, an entirely different kind of anxiety was building. Patents do not last forever. They are granted for a fixed number of years, and once that window closes, any other manufacturer with the right approval can start making a chemically identical, dramatically cheaper version of the same drug. When that happens, prices collapse practically overnight, and the company that once owned the market finds itself competing against its own former product at a fraction of the price. Executives call this moment the patent cliff, and it is about as gentle as the name suggests. Adderall's most lucrative protections were edging closer to that cliff with each passing year, and everyone at the top of the company knew it. So there sat the reigning champion of attention medication, wildly popular, deeply profitable, and quietly vulnerable on two separate fronts at once. Misuse was chipping away at its reputation in classrooms and courtrooms. Patent expiration was chipping away at its financial future in boardrooms. Somewhere out there, whichever company managed to solve both problems with a single clever molecule stood to inherit an entire kingdom. Nobody at Adderall's parent company particularly wanted to imagine what that molecule might look like, or who might be quietly building it in a modest office park a few states away. There is a certain dark comedy in watching an industry giant defend two flanks at once, without quite being able to fix either one. You cannot simply outmarket a molecule's chemistry, and you cannot legislate away a patent's expiration date no matter how many lawyers you employ. The company sat atop an enormous, profitable mountain, built on immediate-release amphetamine salts, fully aware that mountains built on expiring patents eventually erode, slowly at first, and then all at once. Meanwhile, misuse statistics kept climbing steadily in the background. Campus health surveys kept flagging the same worrying trends, and every news segment about stimulant misuse in classrooms and dorm rooms mentioned the same familiar orange capsule. Success, it turns out, does not exempt you from vulnerability. Sometimes it simply gives vulnerability a much larger, much more visible target to aim at. Here was the awkward truth at the centre of the entire stimulant business. Nearly every amphetamine medication shared the same fatal flaw. It could be defeated by a spoon and a hard surface. Because the active drug was ready to go the instant it dissolved, the whole point of a slow-release, once-a-day formulation could be undone in seconds. All that careful pharmaceutical engineering meant to release the medicine gently across an entire day could be flattened into a fine powder and swallowed all at once. The industry had spent years building elaborate time-release capsules, and the misuse workaround was essentially a paperweight. It was like installing a state-of-the-art security system on a house, and then leaving the key under a rock shaped exactly like a key. Everyone knew the flaw was there. The question was whether anyone could actually design their way out of it. Consider the sheer engineering effort that went into these extended release capsules in the first place. Pharmaceutical scientists spent enormous energy calculating exactly how thick a coating needed to be, how it would slowly dissolve in stomach acid over a period of hours, and how the tiny beads inside would release their contents on a gentle, staggered schedule. It was genuinely impressive chemistry, the kind of precise patient work that normally deserves quiet admiration. And then a single kitchen implement rendered nearly all of it irrelevant. A mortar and pestle, a rolling pin, even the back of a spoon pressed hard enough against a plate, and suddenly hours of intended release collapsed into a single instantaneous dose. This was not some obscure loophole known only to chemistry graduate students either. It became common enough knowledge that emergency room physicians, school counsellors, and worried parents were all quietly aware of it. The entire premise of once-daily dosing, the very selling point that made these medications convenient and appealing in the first place, rested on an honour system that assumed nobody would ever apply a little friction and force to the outside of the capsule. Which, if you think about human nature for even a moment, was always going to be a fairly optimistic assumption. The frustrating part for manufacturers was that they kept solving the wrong layer of the problem. Every new coating, every new bead technology, every new capsule shape addressed the physical barrier standing between the person and the drug. But none of it touched the drug itself. The active ingredient sitting inside remained exactly the same chemical, ready and willing to act the moment it was freed from its packaging. No amount of clever shell design changes what happens once the shell is gone. It is a bit like reinforcing the walls of a cage while leaving the animal inside completely unchanged. Eventually somebody finds a way to open the door, and the same creature walks straight out, just as fast and just as hungry as it ever was. What the industry desperately needed, though nobody had quite articulated it this way yet, was a design that did not depend on the outside holding at all. They needed something where crushing, dissolving, or otherwise attacking the packaging simply revealed nothing useful underneath. Not a stronger cage, but a creature that could not run even when the door was wide open. That kind of solution did not live anywhere on the shelf of existing pharmaceutical technology. It would have to be built from scratch, at the molecular level, by people patient enough to rethink the entire premise from the ground up. Think about how counterintuitive this challenge really was for anyone trained the traditional way in pharmaceutical formulation. Decades of institutional knowledge had been built entirely around the assumption that the packaging was the battlefield, that a better coating, a smarter bead, a more elaborate capsule shell represented the frontier of progress. Asking a formulation scientist to instead ignore the packaging almost entirely and rebuild the molecule itself was a bit like asking a locksmith who has spent 30 years designing increasingly elaborate deadbolts to instead redesign the door so thoroughly that the lock barely matters anymore. It requires letting go of an entire professional instinct built up over a career, trusting instead that the real solution was hiding somewhere nobody in the industry had thought to look, somewhere quiet, unglamorous, and entirely invisible to anyone holding a mortar and pestle. The answer, strangely enough, did not come from one of the towering pharmaceutical giants with their glass skyscrapers and marble lobbies. It came from a modest company most people had never heard of, tucked away in Radford, a small town in rural Virginia. The company was called River Pharmaceuticals, and it was not the kind of place you would expect to rewrite the future of an entire drug class. But New River had one very good idea, and the stubbornness to chase it. While the big players were busy squeezing the last profits out of their existing products, this little company was quietly betting everything on a chemical concept so clever that it sounded almost too simple to work. They were not trying to invent a new drug from scratch. They were trying to reinvent an old one so that it could no longer be tricked. Picture the setting for a moment, because it matters. This was not Manhattan or Boston, or one of the sprawling pharmaceutical research corridors dotted with campuses full of glass and steel. Radford sits quietly along the New River in the rolling hills of southwestern Virginia, a place better known for its scenery than its skyscrapers. It is the sort of town where a pharmaceutical breakthrough feels almost incongruous. The way finding a spaceship parts factory tucked behind a farm stand might feel incongruous. And yet here, in offices that were almost certainly far less glamorous than anything belonging to the giants they were about to compete with, a small team of scientists and executives were quietly pursuing one of the more ambitious rethinks in modern stimulant history. Being small came with real disadvantages. New River did not have the marketing muscle of an established giant, didn't have decades of manufacturing infrastructure already built, and certainly did not have the kind of enormous cash reserves that let larger companies absorb the occasional multi-year research failure without blinking. Every dollar spent chasing this idea was a dollar the company could not spend elsewhere, and every year that passed without a marketable product was a year closer to running out of runway entirely. In other words, this was less a comfortable research initiative and more a genuine bet-the-company gamble, the kind that either ends in triumphant headlines or a quiet dissolution nobody remembers. But being small also came with a strange kind of freedom. Nobody at New River had an existing blockbuster to protect. No beloved legacy product whose sales figures might get cannibalized by an internal competitor. There was no institutional instinct whispering, why disrupt what already works? The company's entire identity could be built around a single disruptive idea without any of the internal politics that so often slow down bigger organizations. Sometimes the biggest innovations do not come from the companies with the most resources. They come from the companies with the least to lose and the clearest possible reason to take the risk anyway. So while the reigning stimulant manufacturers focused on defending their existing territory, this quiet Virginia outfit was busy sketching out something stranger and more ambitious. Not a better version of the same old formula, but an entirely different philosophy for how a stimulant medication should behave once it left the bottle. Nobody outside a small circle of chemists and investors had any idea yet just how far that idea was about to travel. There is something almost cinematic, in a very quiet, unglamorous way, about picturing this little team going about their ordinary working lives without any idea how the story would eventually unfold. Somebody grabbed coffee from the same break room every morning. Somebody drove the same familiar back roads home each evening past the same stretch of Virginia countryside. Nobody clocked out each day thinking they were building the future crown jewel of a $62 billion international acquisition, because at this stage that outcome would have sounded like pure science fiction. Most small biotech companies chasing an ambitious idea like this one quietly fold within a few years, their molecules abandoned, their offices repurposed, their names forgotten by everyone except the people who once worked there. This particular team simply had no way of knowing yet which version of that story they were living inside. The idea at the heart of it all had a name that sounds like something from a science fiction novel, a prodrug. The concept is elegant enough to make a chemist weep. Instead of putting the active, ready-to-work drug straight into the capsule, you attach it to something else. You render it temporarily useless. You build a molecule that does absolutely nothing until the human body itself unlocks it. In other words, the drug arrives at the door asleep, and only the body holds the key to wake it up. It cannot be shortcut, rushed, or crushed into working faster, because the crushing does not touch the lock at all. It was a beautiful reversal of the whole problem. Rather than trying to protect the drug from the person, they would hide the drug inside a chemical disguise that only ordinary human biology could remove. Prodrugs were not, strictly speaking, a brand new concept dreamed up in Radford. The broader idea had existed quietly in pharmaceutical science for years, used occasionally to help certain medications absorb better or survive the harsh environment of the stomach before reaching the bloodstream. But applying that same philosophy specifically to solve amphetamine misuse was a genuinely fresh application, taking an established tool and pointing it at a problem nobody had quite aimed it at before. It is the pharmaceutical equivalent of realizing the hammer sitting in your garage, previously used only for hanging picture frames, could also be repurposed to solve a completely different kind of household disaster. What made the prodrug concept so appealing here was the sheer logical elegance of flipping the entire problem on its head. For decades, the industry had approached abuse deterrence as an external challenge. Build a stronger capsule, build a slower bead, build a tamper-resistant coating. Every solution assumed the drug itself was the same, dangerous, ready-to-fire ingredient, and the only real question was how thick a wall you could build around it. The prodrug approach asked an entirely different question. What if the drug itself simply was not dangerous yet, no matter what you did to the wall around it? Because the danger had not been assembled at all until the body itself finished the job. This kind of thinking required a very particular mindset from the scientists involved. It meant looking past the packaging entirely and rethinking the molecule from its very first atom. It meant asking not how do we protect this drug from misuse, but how do we build a drug that genuinely has nothing to offer anyone trying to misuse it, at least not until a specific, unhurried biological process has run its course. That is a much harder question to answer, but it is also a far more permanent solution because it does not rely on packaging integrity at all. No coating to crush, no bead to grind, just an inert, sleeping molecule waiting patiently for its one true key. It took real institutional courage to chase an idea this abstract, this unproven, and this expensive to develop, especially for a company without an enormous safety net. But somewhere in those quiet Radford offices, the team had convinced themselves this was worth the gamble. If they could pull it off, they would not just be improving an existing drug. They would be inventing an entirely new category of medicine, one where the packaging mattered far less than the chemistry hidden invisibly inside it. It helps to imagine the actual whiteboard sessions where this idea first took shape, because the concept, however elegant in hindsight, must have sounded almost absurd out loud the first few times someone tried to explain it. You want to build an amphetamine that does nothing at all, someone probably asked skeptically, across a cramped conference table. Correct, came the answer. Nothing at all, until a specific chemical process inside a living human body decides otherwise. It is the kind of proposal that either gets you immediately escorted out of the meeting, or, if you're very lucky and very persuasive, gets you a modest research budget and a skeptical nod of cautious approval. Somewhere in Radford, the second outcome happened, and a strange, sleepy little molecule began its long, uncertain journey from sketch to reality. Let's slow down and unpack this gently, because it is genuinely one of the cleverest tricks in modern pharmacy. Take dextroamphetamine, the active stimulant everyone was worried about. Now, instead of leaving it free and ready to work, chemically bolt it to an ordinary amino acid called lysine. Lysine is not exotic. It is a harmless building block of protein found in beans, eggs, and the very food you ate for dinner. On its own, it is about as thrilling as a glass of lukewarm water. But bonded to amphetamine, it acts like a leash. The finished molecule, lisdexamfetamine, is essentially an amphetamine wearing a very boring disguise, holding hands with a nutrient. And as long as those two are joined together, the amphetamine simply cannot do its job. It has been switched off, not by a pill coating, but by chemistry itself. Think about how strange this actually is when you say it out loud. Somewhere inside every capsule sat a stimulant powerful enough to be tightly regulated by the federal government, and yet it was, for all practical purposes, harmless while it sat there. Not harmless because it was weak, harmless because it was incomplete. It needed a partner to come along and physically detach the lysine before it could do anything interesting at all, and that partner was never going to be a spoon, a grinder, or an impatient teenager. It was going to be your own bloodstream, moving at its own unhurried pace. Lysine itself deserves a small moment of appreciation here, because the choice was not accidental. It is one of the essential amino acids your body already relies on constantly, present in ordinary food, entirely unremarkable and completely non-toxic on its own. Choosing something this mundane as the disguise was part of the elegance. The finished prodrug did not require some exotic, hard-to-source chemical partner. It simply borrowed a piece of everyday biology and used it as scaffolding, then relied on the body's own natural processes to eventually take that scaffolding apart again. What is especially satisfying about this design, at least from a pure engineering perspective, is how quietly it solved a problem that seemed almost impossible to solve using packaging alone. Nobody needed a special coating that could resist crushing, freezing, dissolving, or heating, because the coating was never really the point. The real barrier lived inside the molecule itself, at a level no kitchen tool could ever reach. You could grind the capsule into the finest powder imaginable, and you would still be looking at an inactive compound, patiently waiting for a chemical step that simply refuses to happen outside a living body. Of course, none of this would have mattered if the conversion process itself were too easy to hijack, or too slow to be medically useful, or too unpredictable to trust. The entire prodrug idea lived or died on the details of exactly how and where that final transformation happened. And it turns out the human body already had a perfectly good, perfectly reliable mechanism sitting right there, quietly circulating through every single person's veins, just waiting to be put to work. There is a lovely, almost humbling irony buried in that realization. After years of imagining exotic laboratory solutions, elaborate coatings, unusual compounds, complicated mechanical designs, the actual answer turned out to be something every single person reading this sentence already carries inside their own body right now, entirely for free, without ever having asked for it. No patent office grants you exclusive rights to your own bloodstream. No factory needed to manufacture the mechanism from scratch. The chemist simply needed to design a molecule clever enough to take advantage of biology that had already been quietly doing its job, uninterrupted, since long before anyone thought to make it famous. Sometimes the most sophisticated engineering solution is not building something entirely new, but noticing what has been sitting patiently under your nose the whole time. The genius was not just that the two molecules were stuck together, it was where and how they came apart. A simple coating can be scraped away, a time-release bead can be smashed. But a chemical bond is a different kind of lock entirely. To separate the amphetamine from its lysine leash, you do not need force, heat, or a mortar and pestle. You need a specific biological process happening deep inside the body, on a schedule the body sets, not the user. This meant that no matter how you attack the capsule from the outside, the drug inside stayed politely dormant. You could dissolve it, powder it, or stare at it menacingly. None of it mattered. The lock was internal, and the only key was ordinary human metabolism doing its slow, patient work far beyond the reach of anyone in a hurry. Consider just how thoroughly this closed the old loopholes. Snorting the powder no longer produced the fast nasal absorption that made older stimulants appealing to misuse, because there was still nothing active to absorb quickly. Injecting a dissolved solution, historically one of the more dangerous misuse pathways for other drugs, offered no shortcut either, because the bloodstream itself was the very location where the slow unlocking needed to happen in the first place. Even simply swallowing an enormous handful all at once did not produce a correspondingly enormous rush, because the conversion process could only proceed at roughly the same steady rate, no matter how much raw material you threw at it. This is worth sitting with for a moment, because it represents a genuine change in how pharmaceutical companies had been thinking about the entire category of abuse deterrents. For decades, the underlying assumption had been that a determined person, given enough time and the right tools, could eventually defeat any physical barrier placed between them and an active drug. That assumption had proven correct again and again across coatings, beads, and capsule designs of every imaginable complexity. The prodrug approach did not try to build a better physical barrier. It removed the physical barrier from the equation entirely and replaced it with a biological one that simply could not be manipulated by ordinary household methods. There is something almost philosophical buried in this design choice too. Rather than assuming the worst about human behaviour and trying to outmaneuver it with ever more elaborate packaging, the scientists behind this molecule essentially decided to make the packaging irrelevant altogether. It didn't matter what you did to the outside of the pill, because the true safeguard had never lived on the outside in the first place. It lived invisibly, deep inside the chemical structure itself, patiently waiting for the one process capable of unlocking it. And that process, as it turned out, was already happening constantly, quietly, inside every single person who might ever take the medication, whether they intended to misuse it or not. Consider how strange it is that the very same mechanism keeping a well-meaning patient's morning capsule properly regulated was completely indifferent to anyone else's intentions. It didn't check identification. It did not ask why the pill was being taken, or by whom, or under what circumstances. It simply performed its usual unremarkable duty at its usual unremarkable pace, entirely blind to the story unfolding around it. This impartiality is precisely what made the whole design so quietly brilliant. A lock that only worked for good people would eventually be studied, understood, and defeated by someone determined enough. A lock that does not care who is asking, that simply refuses to hurry no matter who stands in front of it, turns out to be a far more stubborn and far more dependable kind of barrier altogether. So where does the magic actually happen? Not in the stomach, and not with any drama. The conversion takes place largely in the bloodstream, where enzymes associated with your own red blood cells quietly snip the lysine away and release the active amphetamine at a steady, measured pace. It is one of the more poetic details in the whole story. Your circulating blood, the same blood keeping you alive right now, doubles as the factory that switches the medicine on. And because that process happens at a fixed biological speed, the drug is released gradually across the day whether you like it or not. There is no fast lane. There is no express option. The body sets the tempo, and the body refuses to be rushed. There is something almost humbling about this detail once you really sit with it. Red blood cells are not glamorous. Nobody ever writes poetry about them. They spend their entire short lives quietly ferrying oxygen from your lungs to the rest of your body, doing the most unglamorous, essential work imaginable without ever asking for credit. And yet, here they were, drafted into an entirely new role, serving as the unwitting production line for one of the more sophisticated pharmaceutical designs of the modern era. It is a bit like discovering the mail carrier who delivers your packages every day has secretly also been assembling them by hand the whole time. The steady, unhurried nature of this enzymatic process is precisely what gave the medication its signature once daily behaviour. Rather than flooding the system all at once and then fading rapidly, the conversion trickled along gradually, releasing small, consistent amounts of active amphetamine over the course of many hours. This produced a far smoother experience for the patient, avoiding the sharp peaks and uncomfortable valleys that older, immediately active stimulants tended to produce. For someone managing attention difficulties throughout an entire school day or work day, that smoothness mattered enormously, offering something closer to a gentle, sustained lift rather than an abrupt jolt followed by an equally abrupt crash. What makes this especially clever from an abuse deterrent standpoint is that this biological speed limit applies no matter how the drug enters your system. It did not matter whether someone swallowed the capsule as intended, dissolved it in liquid, or attempted some other creative delivery method entirely. The conversion still had to happen inside the bloodstream, at the same patient, unhurried pace, governed by the very same enzymes doing the very same job they do every single day regardless of anyone's intentions. You cannot bribe a red blood cell. You cannot threaten it into working faster. It simply continues doing exactly what it has always done, on exactly the timeline biology has already set for it. In a strange way, the entire abuse-resistance strategy of this medication came down to trusting one of the most mundane, overlooked components of human physiology to do a job nobody had ever asked of it before. And it worked. Not through some dramatic feat of chemical engineering happening inside the capsule itself, but through the quiet, reliable competence of a piece of biology that had been running the same shift, uninterrupted, since long before anyone thought to give it new responsibilities. There is something quietly poetic about handing this responsibility to red blood cells specifically. Of all the possible components inside the human body, these are cells with an unusually short, hard-working lifespan, constantly replaced, constantly circulating, forever occupied with the single essential task of carrying oxygen without complaint or fanfare. They are, in a sense, the most reliable employees the body has ever had, never calling in sick, never negotiating for a raise, never once asking to work faster just because someone outside was in a hurry. Handing them a second, entirely unrelated job, quietly dismantling a chemical bond at a steady, predictable pace, turned out to be one of the more elegant design decisions in the whole story, borrowing trust from a part of the body that had never once given anyone a reason to doubt it. This is the part that turned the prodrug from a clever curiosity into a genuine selling point. Because the amphetamine only wakes up after that internal conversion, it didn't matter how someone tried to misuse it. Swallowing a whole handful, dissolving it, or trying to force it into the system by other routes did not produce the sudden, sharp rush that made older stimulants so appealing to misuse. The body still insisted on doing the unlocking at its own gentle speed. In studies designed to measure how much people actually liked the drug, the prodrug consistently produced far less of that rush at equivalent doses. It was still amphetamine, make no mistake, but it was amphetamine on a permanent slow setting. You could knock on the door as loudly as you wanted. The molecule was simply not built to answer quickly. Consider what this actually meant in practical terms for anyone hoping to bypass the medicine's intended use. Every previous generation of stimulant misuse had relied on some version of the same trick, finding a way to deliver the active drug faster and more intensely than the manufacturer intended, producing a sharper, more immediate effect than a slow, steady oral dose ever could. Crushing bypassed the delay coating. Snorting bypassed the digestive system entirely, delivering drug directly through nasal tissue into the bloodstream at remarkable speed. Dissolving and injecting bypassed almost every natural barrier the body has, delivering the full dose almost instantaneously. Each of these methods exploited the same underlying assumption, that once the active ingredient was freed from its packaging, it was ready to act immediately, however it arrived. The prodrug design broke that assumption entirely by removing the readiness itself. There was no active ingredient sitting there waiting to be freed. There was only an inert compound requiring a specific biological process to become active at all, a process that happened at the same unhurried pace, no matter which of these misuse routes someone attempted. Crushing revealed nothing new. Snorting delivered an inactive substance through nasal tissue, gaining no meaningful speed advantage. Dissolving and injecting simply introduced the same dormant compound directly into the bloodstream, where it still had to wait patiently for the same enzymatic conversion as if it had been swallowed normally in the first place. This is precisely why the studies measuring subjective drug liking turned out to be so important and so favourable. Researchers were not simply hoping the new design would theoretically resist misuse. They tested it directly, comparing how much people reported enjoying the prodrug against an equivalent dose of plain, immediately active amphetamine, and the results lined up with the underlying chemistry beautifully. Less rush meant less appeal, and less appeal meant a genuinely reduced likelihood that someone would seek this particular medication out for reasons that had nothing to do with treating a diagnosed condition. None of this made the drug harmless, and nobody involved in its development ever claimed otherwise. But it did something meaningful and measurable. It closed off the classic shortcuts that had defined amphetamine misuse for the better part of a century, not through packaging, but through the patient, unhurried architecture of the molecule itself. Think about what this actually meant for the culture of misuse that had built up around stimulant medications for decades. An entire folk knowledge had developed among people looking to misuse these drugs, passed along casually in dorm rooms and group chats, tips and tricks about crushing, snorting, and timing doses for maximum effect. This new molecule rendered that entire body of accumulated folk knowledge suddenly, quietly useless. All those familiar tricks, refined and shared for generations, simply stopped producing the payoff they once promised. It is a strange kind of obsolescence, watching an entire subculture of shortcuts become pointless overnight, not because anyone announced a crackdown, but because the chemistry itself had simply stopped playing along with rules everyone had assumed would never change. Long before it had a friendly brand name and a colourful capsule, the drug went by something far less charming, NRP-104. It sounded less like a medicine and more like a spare part for a photocopier. But that unglamorous string of letters and numbers represented years of work, quiet obsession, and enormous financial risk for a small company betting its future on a single molecule. In the lab, NRP-104 was tested, measured, tweaked, and coaxed towards something that could survive the brutal gauntlet of regulatory approval. Every prodrug candidate that fails leaves a company poorer and more nervous, and most experimental compounds never make it out of the building alive. But this one behaved. It did what the whiteboard promised. Slowly, that clumsy code name began to look less like a long shot, and more like a genuine contender that might actually reach real patients someday. There is something strangely fitting about the fact that one of the more elegant pharmaceutical designs of the era spent years hiding behind a name that sounded like an error code from a malfunctioning printer. Pharmaceutical code names rarely inspire poetry, and NRP-104 certainly did not break that tradition. Somewhere behind those letters and numbers sat New River Pharmaceuticals itself, quietly stamping its own initials onto the compound the way a craftsman might carve initials into the underside of a chair nobody would ever see. It was functional, forgettable, and completely appropriate for a stage of development where nothing was guaranteed yet. During these years, the molecule existed in a strange purgatory, familiar to anyone who has spent time around drug development. It was promising enough to justify continued funding, yet nowhere near proven enough to celebrate. Every study represented both an opportunity and a threat, capable of either strengthening the case for the compound or quietly ending the entire project with a single disappointing data set. Scientists working on NRP-104 lived inside that tension for years, refining dosing, confirming stability, and slowly building the mountain of evidence that any new medication needs before regulators will even consider taking it seriously. Financially, the stakes could not have been higher for a company of this size. Larger pharmaceutical giants can usually absorb a failed compound here and there, writing off the loss and moving quietly onto the next promising candidate in a crowded pipeline. New River did not have that luxury. NRP-104 was not simply one bet among many. It was close to the entire bet, the central pillar the whole company's future rested upon. Every additional year of testing meant additional spending with no guaranteed return, and every failed trial anywhere else in the industry served as a quiet, unwelcome reminder of how easily this same fate could befall their own molecule. And yet, month after month, year after year, the data kept holding up. The molecule behaved exactly as the underlying chemistry predicted it should. It stayed inert until the body activated it. It converted at a steady, predictable pace. It produced meaningfully reduced abuse-related effects compared to ordinary amphetamine. Slowly, cautiously, the awkward little code name began accumulating something rare and valuable in early drug development, genuine confidence that it might actually survive long enough to earn a real name. There is a particular kind of quiet satisfaction that must have settled over the research team during this stretch, the sort that comes from watching a stubborn hypothesis keep proving itself correct, one careful experiment at a time. Most codename compounds never get to feel this. Most quietly disappear from internal spreadsheets somewhere around year 2 or 3, replaced by the next hopeful candidate, their brief existence remembered only in a discarded folder of failed data. NRP-104 kept refusing to disappear. It kept behaving. It kept converting at the right pace, kept showing the right safety profile, kept producing the right abuse liability numbers researchers had hoped for, but never dared assume in advance. Somewhere around this point, the team likely allowed themselves, just barely, to imagine an actual name, an actual bottle, an actual patient someday taking this exact molecule home from a pharmacy. Turning a promising molecule into an actual approved medicine is a long, expensive, and deeply unglamorous slog. First come the early studies, where researchers confirm that the drug does what the chemistry suggests and does not do a dozen terrible things nobody anticipated. Then come the careful measurements of how it moves through a living system, how quickly it converts, how long it lasts, and how predictably it behaves from one dose to the next. This is the part of drug development that never makes it into the exciting movies. There are no dramatic breakthroughs shouted across a lab. There are spreadsheets, blood samples, and endless graphs. But every one of those unglamorous data points was building a case, brick by patient brick, that this strange little prodrug was not just a neat idea, but a reliable, once-a-day medicine worth taking seriously. Imagine the sheer volume of repetition involved. Every dosage strength needed its own careful measurement. Every measurement needed to be repeated across enough participants to rule out coincidence. Every result needed to be checked, rechecked, and cross-referenced against expectations built from years of earlier laboratory work. Nobody gets a dramatic eureka moment in this phase of development. Instead, researchers get quiet, gradual reassurance, one data point at a time, that the molecule keeps doing exactly what it's supposed to do, batch after batch, week after week. Pharmacokinetics, the branch of science tracking how a drug moves through the body, absorbing, converting, circulating, and eventually clearing out, became the obsessive focus of this entire stage. Researchers needed to know precisely how quickly the lysine bond broke down once it entered the bloodstream, how much active amphetamine appeared at various points throughout the day, and how consistent that timeline remained from one person to the next. Human bodies are not identical machines, and biology loves throwing in just enough natural variation to keep researchers humble. The team needed enough data to prove that despite these small individual differences, the medication behaved predictably enough for doctors to trust with confidence. None of this work photographs particularly well. There is no cinematic moment of a chemist standing triumphantly over a bubbling beaker while dramatic music swells. Instead, picture rows of labelled blood samples sitting quietly in refrigerated storage, researchers hunched over monitors comparing absorption curves, and meetings where the most exciting news anyone shares is that the data continues matching the model almost exactly. It is thrilling only in the sense that consistent, boring success is thrilling to people who understand just how rarely that happens in early pharmaceutical development. And yet this unglamorous groundwork mattered enormously because it formed the entire foundation everything afterward would be built upon. Without rock-solid pharmacokinetic data, no regulator would ever seriously entertain claims about reduced abuse potential or smooth sustained release. The flashy claims that would eventually appear on marketing materials and press releases were only possible because months and years earlier, a quiet team of researchers had painstakingly proven, sample after sample, that the underlying biology genuinely behaved exactly the way the whiteboard sketches had promised it would. It is worth appreciating just how invisible this stage of work remains to everyone outside the industry, even though it is arguably the most important stretch of the entire process. Nobody outside a small circle of pharmacokinetic specialists will ever read the raw absorption curves generated during these years, will ever see the careful spreadsheets tracking exactly how many micrograms of active amphetamine appeared in a volunteer's bloodstream 3 hours after dosing versus 6 hours versus 12. And yet every single confident sentence that would eventually appear on a label, in a doctor's office brochure, or in a glossy magazine advertisement traces directly back to this unglamorous mountain of quiet, repetitive measurement. The showy part of the story always gets the credit. The boring part is what actually built the foundation underneath it. Eventually, the drug had to face its most important test of all: real human beings, real symptoms, and rigorous, controlled trials watched over by the medical establishment. The pivotal studies focused on children with attention difficulties, and they were led in part by prominent researchers in the field of pediatric psychopharmacology. These were not small, casual experiments. They were large, multi-site trials designed to prove, beyond reasonable doubt, that the medicine reduced symptoms steadily across a full day, with a tolerability profile that doctors could trust. The stakes were enormous. A failure here would not just embarrass the company, it would erase years of work and a mountain of money in a single stroke. But the results held. The drug worked, the effects lasted through the afternoon and into the evening, and suddenly a tiny Virginia company was holding something that looked a great deal like a blockbuster. Running a trial of this scale required an almost logistical miracle behind the scenes. Multiple research sites needed to coordinate consistent protocols, ensuring that a child enrolled in one city received the exact same careful measurement and evaluation as a child enrolled hundreds of miles away. Parents needed to track symptoms honestly and consistently over weeks at a time. Teachers in many cases contributed observations about classroom behaviour and focus, adding yet another layer of real-world validation beyond what happened inside a sterile clinical office. All of this data needed to be gathered, compared, and statistically analysed with enough rigour to satisfy sceptical regulators who had seen plenty of promising compounds fail this exact test before. The involvement of respected researchers in pediatric psychopharmacology added crucial credibility to the entire effort. This was not a fringe project run by unknown scientists, hoping nobody would ask too many questions. Serious established experts in childhood attention disorders were directly involved in designing and overseeing these studies, lending their reputations to the process, and, in doing so, signalling to the broader medical community that this compound deserved to be taken seriously, rather than dismissed as just another marketing gimmick dressed up in chemistry. What made the results genuinely compelling was not simply that the medication worked, but how consistently and predictably it worked across an entire day. Many earlier stimulant formulations struggled with a frustrating afternoon fade, where morning medication wore off well before the school day ended. leaving children and teachers alike watching focus quietly evaporate sometime around lunch. This new formulation, thanks to its steady, unhurried conversion process, maintained meaningful symptom control late into the afternoon and even into the early evening, addressing one of the most persistent practical complaints doctors and parents had voiced about existing treatments for years. When the final results came together, they represented far more than just another successful clinical trial. They represented validation of an entire underlying philosophy, proof that a prodrug built around chemical dormancy and biological unlocking could genuinely deliver consistent, meaningful, all-day symptom relief. For the modest team back in Radford, watching those results solidify must have felt like finally exhaling after holding their breath for the better part of a decade. Imagine, for a moment, the parents on the other side of this data, the ones filling out those weekly symptom questionnaires after school pickup, the ones quietly hoping this new, unfamiliar medication might finally give their child a steadier, calmer afternoon than the last formulation had managed. None of them knew anything about lysine bonds or red blood cell enzymes. They simply noticed whether homework got easier, whether dinner table conversations felt calmer, whether the familiar late afternoon crash that had haunted previous medications finally seemed to ease. Behind every dry statistical table showing sustained symptom improvement through the evening hours sat dozens of these small, ordinary, deeply human moments, quietly accumulating into the exact kind of real-world evidence no laboratory measurement alone could ever fully capture. Here is where the story takes its most fascinating turn, because the makers did not only have to prove the drug worked, they had to prove it was harder to abuse, and that meant measuring something surprisingly awkward: how much people enjoyed it. Researchers ran studies specifically designed to test the drug's so-called liking effects, comparing how appealing the prodrug felt against an equivalent dose of ordinary amphetamine. It is a strange thing to build a clinical trial around, essentially asking whether a substance is fun in the wrong way. But the findings became the entire foundation of the drug's identity. At equivalent doses, the prodrug produced significantly less of that pleasurable rush. It was the scientific proof behind the marketing dream. The drug helped without dazzling, treated without tempting, and worked without whispering seductively in your ear. Picture the peculiar nature of designing a study like this. Researchers needed volunteers, often individuals already familiar with recreational stimulant use, willing to take carefully measured doses of different formulations and then honestly report back exactly how pleasurable the experience felt. Participants filled out standardized questionnaires rating euphoria, alertness, and overall desirability of the drug experience, effectively turning subjective pleasure into something that could be measured, charted, and statistically compared. It is an unusual kind of science, sitting somewhere between pharmacology and psychology, treating enjoyment itself as a data point worth taking seriously. The comparison at the heart of these studies was elegantly simple in design, even if the underlying science was anything but. Give one group an equivalent dose of ordinary, immediately active amphetamine. Give another group the same effective dose delivered through the prodrug. Then simply ask both groups to rate how much they liked the experience, how strong the euphoric effects felt, and how likely they would be to want more. If the underlying chemistry theory held up, the prodrug group should report a noticeably blunted, less exciting experience despite receiving a pharmacologically equivalent dose of active drug once conversion was complete. And that is exactly what happened. Across these studies, participants consistently reported less euphoria, less of that pleasurable rush, and generally less desire to repeat the experience when taking the prodrug compared to standard amphetamine at equivalent doses. This was not a small marginal difference either. The gap was significant enough to become one of the central pillars supporting the entire regulatory and marketing case for the medication, transforming what had been a purely theoretical chemistry argument into hard, measurable human evidence. For a company hoping to convince skeptical regulators and cautious doctors that this new formulation genuinely represented a meaningful advance, rather than just clever branding, this data proved absolutely essential. It allowed the company to make a claim that few stimulant medications before it had ever been able to make with real scientific backing, that the drug worked exactly as intended for patients who needed it, while offering meaningfully less appeal to anyone hoping to chase a different kind of experience entirely. There is something almost delightfully backwards about a pharmaceutical achievement, measured by how unremarkable it managed to feel to the wrong audience. Most drug development chases the opposite goal entirely, hoping for stronger effects, more noticeable relief, more dramatic before and after stories. Here, the entire second half of the research program was essentially built around proving the drug could be quietly, deliberately underwhelming to exactly the people who are not supposed to be taking it in the first place. It is the pharmaceutical equivalent of designing a thrilling amusement park ride specifically engineered to feel thoroughly boring to anyone who snuck in without a ticket, while still delivering the intended experience beautifully to everyone who paid their way through the front gate honestly. Armed with trial data and abuse potential studies, the company assembled the enormous stack of evidence required to convince regulators that this drug deserved a place in the world. Getting a stimulant approved is never simple, and getting one approved with claims about reduced abuse potential is harder still. Regulators are professionally skeptical, and rightly so. They have seen countless miracle molecules arrive with confident promises and quietly disappoint. So the case had to be airtight. Every claim needed a chart behind it. Every reassurance needed a study. The application was less a document and more a fortress of data, built to withstand exactly the kind of hard questioning it was about to receive. And as the paperwork made its slow journey through the regulatory machine, a small company in Virginia held its breath and waited to learn whether a decade of belief was about to pay off. The scale of a modern drug application is genuinely difficult to picture unless you have seen one in person. These are not tidy folders of paperwork. They are massive compilations spanning tens of thousands of pages, containing everything from raw laboratory data to detailed manufacturing procedures to complete transcripts of every clinical trial conducted along the way. Regulators expect complete transparency, every side effect documented, every statistical method justified, every conclusion supported by underlying evidence rather than confident assertion. For a molecule making genuinely novel claims about reduced abuse potential, the scrutiny only intensified, since regulators understood exactly how much both doctors and patients would come to rely on that specific claim once the drug reached pharmacy shelves. Behind the scenes, this stage of the process involved careful, sometimes tense back and forth communication between company scientists and government reviewers. Questions arrived requesting additional clarification. Requests came in for supplementary analysis of existing data. Occasionally, reviewers asked entirely new questions the original studies had not been specifically designed to answer, forcing the company to either dig through existing data for an acceptable answer, or, in the worst cases, consider running entirely new studies that could add months or even years to an already lengthy process. Every one of these exchanges represented both an opportunity to strengthen the case and a genuine risk of exposing some previously overlooked weakness. For the small team who had spent years nurturing this molecule from an early whiteboard sketch through countless rounds of laboratory testing and clinical trials, this final regulatory gauntlet must have felt simultaneously like the finish line and the most dangerous stretch of the entire journey. All the careful, patient science in the world means little if the final application fails to convince the very people whose approval determines whether any of it ever reaches an actual patient. Every year of work, every dollar spent, every late night spent poring over dosing charts and liking effect questionnaires had led to this single, enormous stack of paper now sitting in front of federal reviewers, waiting for a verdict that would either validate an entire decade of quiet, stubborn belief or send the whole project back to the drawing board. There is a particular, almost unbearable stillness that must settle over a small company during this final waiting period, after every document has been submitted and every question has been answered as thoroughly as possible, when nothing remains to be done except wait for a decision entirely out of your own hands. Larger companies can sometimes distract themselves during this stretch with a dozen other projects running simultaneously. A company built almost entirely around one single molecule does not have that luxury of distraction. Every phone call might be the one that matters. Every unread email might contain the verdict. It is the corporate equivalent of pacing anxiously in a waiting room, except the stakes on the other side of that door happen to be measured in years of accumulated work and the entire future of the company itself. Then came the moment everything had been building toward. In February of 2007, the drug received its marketing approval for the treatment of attention difficulties in children aged 6 to 12. After the code name, the trials, the endless data, and the sleepless nights, NRP-104 finally had a real name, a real indication, and a real future. It was celebrated as the first stimulant of its kind, the first prodrug built specifically to lower abuse potential, while still delivering a full day of steady effect. For the little company that had bet everything on a single clever molecule, this was the payoff, the vindication, the proof that the whiteboard idea had been right all along. But approval was not the finish line. In the pharmaceutical world, approval is the starting gun, and the race that followed would be about money, marketing, and empire on a scale the small Virginia team could barely imagine. Try to imagine the actual moment that news arrived. Somewhere inside those modest Radford offices, a phone call or an official notice confirmed what years of data had already suggested was likely, but which nobody dared fully celebrate until it was official. There is a particular kind of exhausted relief that settles over a team after a moment like this, equal parts triumph and disbelief, the sensation of finally setting down a weight you had been carrying so long you nearly forgot what it felt like to walk without it. Champagne corks might have popped somewhere, though it is just as easy to imagine a room full of scientists simply sitting in stunned, grateful silence for a moment before the celebration properly began. The approval itself specified something fairly narrow at first, a targeted use for children between the ages of 6 and 12 struggling with attention difficulties, alongside a launch plan built around 3 distinct dosage strengths, designed for straightforward, once-daily use. This was, in many ways, a deliberately modest starting point, the kind of careful, controlled introduction regulators generally prefer for genuinely novel compounds. Prove yourself here first, in a well-studied population, before anyone starts talking about expanding into new territories. But modest as that initial approval may have looked on paper, its significance rippled outward almost immediately. Being recognized as the very first prodrug stimulant approved specifically with reduced abuse potential in mind was not a small distinction. It represented genuine scientific novelty, the kind regulatory bodies do not hand out casually or often. Medical journals took notice, industry analysts took notice, and perhaps most importantly, larger pharmaceutical companies watching from the sidelines took very careful notice indeed, immediately beginning to calculate exactly how valuable a molecule like this might become once it found its way into a much larger, much better funded distribution machine. for the scientists and executives who had spent years chasing this single idea through countless setbacks and uncertainties. February of 2007 represented the closing of one extraordinary chapter, but almost nobody involved fully appreciated yet just how quickly and dramatically the next chapter was about to begin, or how little of it would remain in their own hands once the bigger players started paying attention. There is a particular kind of bittersweet irony sitting quietly underneath every small company's approval day celebration, one that rarely gets acknowledged out loud in the moment itself. The very success that finally proves your idea was worth pursuing is often precisely the success that makes larger, wealthier competitors start circling with acquisition offers. Approval day feels in the moment like the mountain peak of an entire journey. In hindsight, it more often turns out to be a base camp, the point where a much larger, much better resourced expedition takes over the climb entirely, while the original team who mapped the route in the first place gets handed a generous check and a polite invitation to step quietly aside. Now, before anyone imagined this was some gentle, harmless version of amphetamine, the authorities had a firm reminder to deliver. Despite all the clever chemistry and the reduced liking studies, the drug regulators still classified it in the most tightly controlled category available for medicines with accepted medical use. Schedule 2, the same restrictive category as the older, more obviously risky stimulants. The message was unmistakable. Reduced abuse potential is not the same thing as no abuse potential. The prodrug made misuse harder and less rewarding, but it did not perform a miracle. It was still at its core amphetamine, just amphetamine wearing a very clever disguise and moving in slow motion. So the drug entered the world with a genuine innovation in one hand and a serious government-mandated warning label in the other. Cleverness, it turned out, does not exempt you from caution. This classification decision arrived through the Drug Enforcement Administration's own careful review process, running in parallel with the broader approval pathway, and it carried real practical consequences for how the medication would be handled at every step from manufacturing through pharmacy dispensing. Schedule 2 substances face some of the strictest regulatory requirements available for any medically approved drug, including careful tracking of manufacturing quantities, restrictions on prescription refills, and heightened security requirements at every stage of distribution. None of that bureaucratic weight simply disappeared because a clever chemist had found a way to slow down the activation process. There is a certain dry irony sitting at the heart of this classification decision. Here was a company that had spent years and untold amounts of money building an elaborate case for genuinely reduced abuse potential, only to have federal regulators respond with what amounted to a polite but firm reminder that this remained, fundamentally, the exact same controlled substance category as everything that came before it. It is a bit like spending years training a large, powerful dog to be exceptionally gentle and well-behaved, only to have the city still require the same sturdy leash and fence as every other large dog in the neighbourhood. The training genuinely mattered. The underlying nature of the animal had not disappeared. For doctors prescribing the medication and pharmacists dispensing it, this classification served as a useful, built-in guardrail against any temptation to treat the new formulation too casually, simply because of its favourable marketing story. Every prescription still required the same careful documentation, the same restrictions on quantity, and the same professional vigilance expected of any Schedule 2 stimulant. The chemistry had genuinely made misuse harder and less appealing. It had not and could not erase the underlying pharmacological reality of what the molecule eventually became once fully activated inside the body. In many ways, this classification decision turned out to be an important, sobering counterweight to some of the more enthusiastic marketing language that would soon follow. It stood as an official, government-issued reminder that innovation in delivery mechanism, however genuinely clever, does not rewrite the fundamental risk profile of the underlying chemistry. The disguise had changed. The dance partner underneath it had not. Consider how this classification decision must have landed among the marketing teams who'd spent so many months crafting careful, hopeful language around reduced abuse potential. There is a certain deflating quality to watching your carefully worded, scientifically supported achievement receive the exact same restrictive filing cabinet as every stimulant that came before it. No gold star, no special asterisk of leniency, just the same tightly monitored Schedule II paperwork every pharmacy technician in the country already knew by heart. And yet this outcome was, in its own way, exactly the right kind of caution for regulators to apply. A genuinely improved seatbelt does not earn you the right to remove the airbags entirely. It simply makes the overall vehicle a little bit safer than it used to be, while every other safety mechanism still stays firmly, sensibly in place. The small company would not stay small for long, and in fact it would barely remain a company at all. Around the very same time as the approval, a much larger pharmaceutical player named Shire swooped in and agreed to acquire new River Pharmaceuticals for approximately $2.6 billion in an all-cash deal. It was a staggering sum for a business built almost entirely around a single molecule. But Shire was not paying for the buildings in Virginia or the office furniture. It was paying for the future. It was buying a once-a-day prodrug stimulant with a genuine abuse-resistant story at the exact moment its own aging blockbuster was heading toward the patent cliff. In one enormous transaction, the tiny Virginia dreamers cashed out, and the drug they had nurtured from a whiteboard sketch became the crown jewel of a pharmaceutical giant. Consider the sheer speed and audacity of this transaction for a moment. This was not some drawn-out courtship stretching across years of careful negotiation. The acquisition agreement was announced within days of the approval itself becoming public, suggesting Shire had been closely watching this small Virginia company's progress for quite some time already, quietly preparing to move the moment regulatory success became official. $2.6 billion in cash is not a figure any company commits casually, and the willingness to move so quickly signals just how confident Shire's leadership already was that this compound represented exactly the future asset they desperately needed. For the executives and scientists at New River, this acquisition represented an almost dizzying transformation of fortune. A modest company operating out of a small Virginia town, built around years of patient, uncertain work on a single ambitious molecule, suddenly found itself the center of a multi-billion-dollar transaction, attracting national business headlines. Shareholders who had weathered years of uncertain, high-risk investment in an unproven prodrug concept found their patience rewarded in spectacular fashion. It is the kind of transformation that happens to vanishingly few small biotechnology companies, the improbable jackpot outcome that every early-stage pharmaceutical investor secretly hopes for while rationally expecting far more modest results. But this deal was never really about celebrating a small company's improbable success story. However satisfying that narrative might feel, it was at its core a purely strategic calculation on Shire's part, a carefully timed purchase of exactly the asset needed to solve a very specific, very urgent problem facing their own existing product line. The timing was not coincidental. It was the entire point. Try to imagine the mood inside the Radford offices the day this acquisition became public knowledge. Years of uncertain, underfunded, deeply risky work suddenly resolved itself into an enormous, tangible number. The kind of figure that transforms careers, retirements, and entire life trajectories in a single afternoon. Some employees likely felt pure relief, the sense of a long, exhausting climb finally reaching solid, stable ground. Others may have felt something closer to quiet grief, watching a scrappy, independent project they had nurtured personally for years get folded seamlessly into the enormous, impersonal machinery of a much larger corporation. Both reactions make perfect sense. Billion-dollar acquisitions are always described in the confident, bloodless language of corporate finance, but they happen to actual people, sitting at actual desks watching years of their own working lives get valued, priced, and sold in a single afternoon. To understand why anyone would pay billions for one capsule, you have to appreciate the quiet terror stalking Shire's balance sheet. The company already dominated the attention medication market with its established amphetamine product, but that product's most valuable protections were fading. When a drug loses its patent shield, cheaper copies pour in, prices collapse, and a river of profit slows to a trickle almost overnight. Shire needed a successor, a fresh product with fresh protections and a compelling new story to tell doctors and patients. And here was the perfect answer, gift-wrapped. A next-generation stimulant, once a day, with a built-in abuse-resistance narrative and a long runway of patent protection ahead of it. It was not just a new drug, it was a lifeboat. And Shire climbed aboard with $2.6 billion, fully aware that in this business the next blockbuster is always worth more than the last one. Every pharmaceutical company living off a single dominant product faces the same uncomfortable arithmetic eventually. Patents provide temporary, government-granted exclusivity, not permanent ownership, and that exclusivity always has an expiration date printed somewhere in fine legal text that executives track with the same nervous attention most people reserve for their own mortgage payments. As that expiration date approaches, the entire company's future revenue increasingly depends on finding a replacement blockbuster before the existing one loses its financial protection entirely. This is not a hypothetical worry. It is one of the most predictable, well-documented crises in the entire pharmaceutical industry, repeating itself company after company, decade after decade. What made this particular acquisition so appealing was not merely that it offered a replacement product, but that it offered a replacement product with a genuinely superior underlying story. Rather than simply launching a slightly reformulated version of the same aging chemistry, Shire could now offer doctors and patients an entirely new category of medication, built around novel science, backed by genuinely compelling abuse liability data, and protected by a fresh patent timeline stretching many years into the future. From a purely commercial perspective, this was close to the ideal solution, solving the misuse problem, the patent problem, and the aging brand perception problem, all within a single acquisition. There is also something worth noting about the psychological comfort this deal likely provided to Shire's own leadership and shareholders. Facing a looming patent cliff is genuinely stressful for any pharmaceutical executive, carrying with it the very real threat of collapsing revenue and anxious investors demanding answers. Suddenly having a credible, scientifically validated successor waiting in the wings transforms that anxious countdown into something far more manageable, a bridge to cross rather than a cliff to fall from. $2.6 billion is an enormous sum by almost any measure, but against the backdrop of protecting an entire company's long-term revenue future, it likely felt to the executives signing the deal less like an extravagant gamble and more like an urgently necessary insurance policy. It is worth remembering just how unforgiving financial markets can be toward companies that fail to plan adequately for their own patent expirations. Investors do not politely wait for an aging blockbuster to gently wind down. The moment analysts start openly discussing an approaching patent cliff, stock prices often begin drifting downward well in advance, as the market tries to price in a decline that has not technically happened yet. Acquiring a credible successor early, before that anxious drift fully set in, allowed Shire's leadership to walk into investor calls with a considerably more reassuring story to tell. Rather than admitting uncertainty about the future, they could point directly at a newly approved, scientifically differentiated medication and confidently describe exactly where the next decade of growth was going to come from. With approval secured and a giant company behind it, the drug was launched into the world with all the force a modern pharmaceutical marketing operation can muster. It arrived in a handful of dosage strengths, promised a full day of coverage from a single morning capsule, and carried a story that practically sold itself. Here, at last, was a stimulant that treated the problem while resisting the misuse. Sales representatives fanned out, materials were printed, and doctors were introduced to the shiny new option on the block. In a market hungry for something fresh and defensible, the timing was close to perfect. The drug was not competing on price, it was competing on story, and the story was irresistible, effective, convenient, and cleverly built to behave itself. Whether reality would live up to the brochure was, as always, a question for later. For now, the machine roared to life. Modern pharmaceutical marketing is a genuinely enormous operation, involving considerably more than a few glossy advertisements placed in medical journals. Sales representatives, often trained extensively on the underlying science, fanned out across the country to visit prescribing physicians directly, walking them through study results, dosing charts, and the specific abuse liability data that made this particular medication stand apart from everything already crowding the market. Conferences hosted presentations. Continuing education sessions for doctors quietly wove in favourable mentions of the new option. Every available channel capable of reaching a prescribing physician's attention was activated almost simultaneously, creating a kind of coordinated awareness campaign. Most industries outside pharmaceuticals rarely attempt at this scale. Patients and parents encountered their own parallel wave of marketing, somewhat more subdued given regulatory restrictions on direct stimulant advertising, but still present through informational materials distributed in doctors' offices, carefully worded website content, and media coverage generated by the genuine novelty of the underlying science. The story practically wrote itself for journalists covering the pharmaceutical beat. A cleverly designed molecule that could not easily be crushed, snorted, or abused in the traditional sense offered an inherently compelling narrative hook, the kind that generates coverage without requiring much additional embellishment. What made this particular launch especially effective was the sheer alignment between genuine scientific merit and marketable narrative. Plenty of pharmaceutical launches require marketing teams to work overtime finding creative angles to differentiate a fairly ordinary product from its competitors. This one needed considerably less creative effort because the underlying prodrug science genuinely was different, genuinely was novel, and genuinely did address a long-standing, widely acknowledged problem within the entire drug category. When the truth itself makes for compelling marketing copy, the entire launch effort becomes considerably smoother. Behind all of this coordinated enthusiasm, of course, sat the quieter commercial reality driving every decision. Shire needed this launch to succeed, and succeed quickly, in order to justify the enormous acquisition price paid just months earlier, and to begin building the replacement revenue stream its aging existing product could no longer reliably provide. The marketing machine was not merely celebrating clever science for its own sake, it was working with considerable urgency to convert years of patient laboratory research into the kind of widespread prescribing habits capable of generating billions of dollars in annual revenue. Picture the sheer coordination required to launch a medication at this scale, within a market already saturated with established competitors and deeply ingrained prescribing habits. Doctors who had comfortably prescribed the same familiar stimulant medications for years needed genuinely compelling reasons to consider switching at least some of their patients to something new and unfamiliar. Insurance companies needed convincing that reimbursement made sense. Pharmacies needed adequate supply chains established well before the first prescription ever reached a counter. Every one of these moving pieces required careful, deliberate coordination happening simultaneously across an enormous organization, all converging toward the same single goal: making sure that the moment a doctor decided this medication might be right for a patient, every practical piece of infrastructure needed to fulfill that prescription was already quietly and visibly in place. At the center of every pitch sat those all-important words: lower abuse potential. It was the drug's identity, its differentiator, the single feature that separated it from the crowded field of ordinary stimulants. And it was, importantly, true. The studies really did show reduced liking effects, and the prodrug design really did make certain kinds of misuse pointless. But phrases like lower abuse potential come with a quiet asterisk that marketing rarely dwells on. Lower is a comparison, not a promise of safety. A shorter cliff is still a cliff. The drug was genuinely harder to misuse in the classic ways, and that was a real public health advance worth celebrating. But it was never invincible, never harmless, and never immune to determined misuse or ordinary overuse. The story was honest. It was just also, like most good marketing, extremely careful about exactly which words it chose to emphasize. There is a particular skill involved in crafting pharmaceutical messaging that remains scientifically accurate while still landing with maximum persuasive force, and this particular phrase represented that skill at close to its finest. Lower abuse potential is, strictly and technically, an entirely truthful description supported directly by the underlying clinical data. And yet the phrase also does an enormous amount of quiet emotional work, allowing listeners to fill in a considerably more reassuring conclusion than the actual data technically supports. Doctors hearing this phrase, and parents hearing it second-hand from doctors, understandably tend to relax somewhat more than the careful, hedged language of the original clinical studies would strictly justify. This is not necessarily evidence of dishonesty so much as evidence of how marketing language naturally operates within the boundaries of regulatory truthfulness requirements. Every claim made in official pharmaceutical marketing materials must be directly supportable by underlying clinical evidence, reviewed carefully by both internal legal teams and external regulators before ever reaching a doctor's desk. The phrase lower abuse potential passed through exactly this kind of scrutiny and earned its place in official materials precisely because it was true. The skill lay not in bending the truth, but in selecting the specific true statement capable of generating the most favorable possible impression among people who might not have time to read the full underlying study themselves. Doctors, to their credit, generally understood the nuance better than casual observers might expect. Prescribing physicians are trained to read past marketing headlines, toward the underlying data, and many appreciated the genuine scientific novelty represented by the reduced liking studies while still maintaining appropriately cautious prescribing habits consistent with any Schedule II controlled substance. The real risk of oversimplified messaging tended to appear further downstream, among patients, parents, and casual observers who encountered only the confident headline without ever seeing the more carefully hedged language buried within the actual clinical trial documentation. In the end, this particular selling point captured something genuinely important about how pharmaceutical innovation gets communicated to the wider world. Real scientific advances, however meaningful, rarely translate into simple, absolute promises once they leave the laboratory and enter a marketing department. They become comparative claims, carefully worded, technically accurate, and just persuasive enough to shape perception well beyond what the underlying data, read closely and skeptically, would strictly justify on its own. It is worth considering how this same pattern plays out across nearly every corner of consumer life, not just pharmaceuticals. A cereal box boasting less sugar than a leading competitor rarely mentions that both products still contain a fairly alarming amount of sugar overall. A car advertised as safer than average still crashes exactly the same way physics has always dictated cars crash. Comparative language is technically honest and psychologically powerful, precisely because human brains are wired to relax at the sound of reassurance, rarely pausing to ask reassurance compared to exactly what and by exactly how much. This medication's marketing followed that same well-worn psychological groove, using entirely truthful comparative language to build a considerably more comforting impression than the underlying carefully hedged clinical data technically supported on its own. Strip away the elegant chemistry and the confident branding, and one stubborn fact remains at the bottom of the bottle. Once the body finishes its quiet unlocking, what circulates is dextroamphetamine, the very same active stimulant that has been prescribed, praised and misused for the better part of a century. The prodrug changed how the drug arrived and how quickly it could be released. It didn't change what it ultimately became. This is the caveat that no amount of clever engineering could erase. It could still be habit-forming, still be overused, still carry the genuine risks that come with any powerful stimulant. The innovation was real and meaningful, but it was an improvement in delivery, not a transformation into something gentle. Underneath the disguise, the old familiar molecule was still there, patient and unchanged, waiting for the body to set it free. It is worth pausing here and appreciating just how easy it would have been for the surrounding excitement to obscure this simple, unglamorous fact. Years of laboratory work, billions of dollars in acquisitions, coordinated marketing campaigns, and genuinely impressive scientific novelty all swirled together around this molecule. And somewhere in the middle of that swirl sat one plain, stubborn truth that no press release ever needed to hide because it was never actually false. This medication worked because it eventually became amphetamine. All of the cleverness lived entirely in the timing and manner of that transformation, never in changing what the transformation ultimately produced. This distinction matters enormously for anyone trying to understand the medication honestly, rather than simply absorbing whichever headline reached them first. A genuinely novel delivery mechanism is not the same thing as a genuinely novel drug. The active ingredient circulating in a patient's bloodstream several hours after taking this medication is chemically identical to the active ingredient circulating after taking any other properly dosed amphetamine product. Same neurotransmitter effects, same basic risk profile once fully active, same potential, over time and with sufficient misuse, for dependence and the broader consequences that accompany chronic stimulant misuse. None of this diminishes the genuine value of the delivery innovation itself. Reducing the ease and appeal of the classic misuse pathways represents real, measurable harm reduction at a population level, even while acknowledging that the underlying chemical risk never fully disappeared. Public health rarely deals in absolute solutions. It deals far more often in meaningful, incremental improvements that reduce harm without eliminating it entirely, and this medication represented exactly that kind of honest partial progress rather than the complete miracle some of the more breathless coverage occasionally implied. Perhaps the most useful way to hold both truths simultaneously is this: The disguise was real, clever, and genuinely valuable. The thing wearing the disguise never changed at all. Anyone taking this medication or prescribing it deserved to understand both halves of that sentence equally well, rather than only the half that happened to make for better marketing copy. There is a useful, almost meditative exercise available to anyone who wants to understand pharmaceutical innovation clearly, rather than simply absorbing whatever headline arrives first. Asika every single time, exactly what changed and exactly what stayed the same. In this particular story, what changed was genuinely remarkable, an entire new category of chemical design, a novel solution to a decades-old misuse problem, a smoother delivery curve that helped countless patients feel more evenly supported throughout their day. What stayed the same was equally worth naming clearly, without embarrassment or spin. The active ingredient itself, once finally unlocked, remained exactly what amphetamine has always been since a curious chemist first isolated it more than a century earlier. Holding both of those truths in mind at once, without letting either one quietly erase the other, is really the entire discipline of understanding medicine honestly. A drug approved only for young children is a good business. A drug approved for nearly everyone is a fortune. So it was no surprise that the approved uses soon began to expand outward like ripples in a pond. The following year brought approval for adults, dramatically widening the pool of potential patients from a small slice of childhood into the vast, sprawling world of grown-ups juggling careers, deadlines, and attention that never seems to stretch far enough. Each expansion meant more prescriptions, more revenue, and a firmer grip on the market. The once tiny Virginia molecule was no longer a niche pediatric option. It was becoming a household name, prescribed across age groups and life stages, quietly embedding itself into the daily routines of millions of people who'd never once thought about lysine, red blood cells, or the clever leash holding their morning capsule in check. This expansion into adult prescribing represented a genuinely enormous shift in the medication's commercial potential, and it followed a well-worn pattern familiar throughout pharmaceutical history. Medications frequently begin their regulatory life with narrow, carefully studied approvals in specific populations, often children, before gradually expanding into broader age ranges as additional clinical trials demonstrate safety and effectiveness in those new groups. This cautious, incremental approach makes sense from a regulatory safety perspective, but it also happens to align remarkably well with commercial strategy, since each new approved population represents an entirely new wave of potential prescriptions. Adult attention difficulties had, by this point in medical history, become an increasingly recognized and increasingly diagnosed condition in its own right, no longer dismissed as something people simply outgrew somewhere around adolescence. A growing body of research throughout the preceding decades had established that attention difficulties frequently persisted well into adulthood, affecting careers, relationships, and daily functioning in ways that had previously gone unaddressed or misdiagnosed as something else entirely. This shifting medical understanding created exactly the kind of receptive market ready to embrace a new treatment option, the moment regulatory approval opened that door. The practical impact of this expansion rippled outward in every direction. Primary care physicians, not just specialized pediatric prescribers, began considering the medication for their adult patients. Workplace conversations about productivity and focus increasingly, if quietly, intersected with prescription stimulant use among working professionals. The medication's identity shifted correspondingly, transforming from a childhood attention treatment into something considerably closer to a mainstream, cross-generational household name, recognized and requested by patients across a remarkably wide span of ages and life circumstances. For the company managing this expanding empire, each new approved indication functioned almost like planting a new flag on previously unclaimed commercial territory. What had begun as a narrow, carefully targeted pediatric medication was steadily transforming into something with genuinely mass-market reach, all while the underlying chemistry, the quiet lysine leash and its patient bloodstream unlocking, remained precisely the same as it had been from the very first approved capsule. Consider the sheer breadth of daily life this expansion eventually touched. A working parent managing morning deadlines, a graduate student finishing a dissertation at an hour polite society generally considers far too late, a small business owner juggling invoices, meetings, and a household simultaneously. Each of these entirely different lives, once separated by age and circumstance from the original narrow pediatric approval, now found themselves potentially reaching for the exact same orange and white capsule each morning. The molecule had not changed one atom since its earliest approved form. What changed was the sheer size of the audience now permitted by regulators and by evolving medical understanding alike to consider it a legitimate part of their daily routine. Then came one of the most intriguing chapters of all. In 2015, the drug earned approval for an entirely different condition, moderate to severe binge eating disorder in adults. This was a genuinely novel move because no medication had previously been approved specifically for that condition, and here was a stimulant stepping into a role no one had expected. To supporters, it was a meaningful advance for people struggling with a serious and undertreated disorder. To skeptics, it looked suspiciously convenient, a way to open a brand new market for an existing drug just as competition loomed on the horizon. The truth, as usual, sat somewhere in the thoughtful middle. It was both a real treatment for real suffering and a very shrewd piece of commercial strategy. In pharmaceuticals, those two things are not opposites. Very often they are the exact same decision seen from two different angles. Binge eating disorder had, for many years, existed in a strange medical limbo, widely acknowledged by clinicians as a genuine and often deeply distressing condition, yet lacking any medication specifically approved to treat it. Patients struggling with recurrent, distressing episodes of binge eating had access to various forms of therapy, and occasionally medications approved for other conditions used somewhat improvisationally, but nothing carried the specific official backing of dedicated clinical trials and formal regulatory approval. This left an unmistakable gap in the treatment landscape, one that any company willing to invest in the necessary research stood to fill first, gaining an enormous head start in an entirely uncontested therapeutic category. The underlying scientific rationale for testing a stimulant medication against this particular condition made more sense than casual observers might initially assume. Stimulant medications influence the same neurotransmitter systems implicated in impulse control and reward processing, systems increasingly understood to play a meaningful role in the compulsive, difficult-to-interrupt eating patterns characteristic of the disorder. Clinical trials specifically designed to test the medication against this new indication needed to demonstrate not just general effectiveness, but a specific, measurable reduction in binge eating episodes among adults meeting rigorous diagnostic criteria for the moderate to severe form of the condition. When those trials succeeded and the new indication received formal approval, the announcement generated exactly the kind of mixed reaction you might expect from an industry watching closely. Advocates for eating disorder treatment, an area long underserved by dedicated pharmaceutical research, welcomed the arrival of the first medication specifically approved for this purpose, viewing it as overdue recognition of a serious condition deserving serious treatment options. More skeptical observers, familiar with the broader patterns of pharmaceutical strategy, noted the suspiciously convenient timing, arriving as it did while the medication's core attention deficit market faced increasing generic competition on the horizon. and wondered aloud whether commercial necessity had driven the research agenda just as much as genuine clinical need. Both interpretations, as is so often the case in pharmaceutical history, contained real truth without fully capturing the whole picture. The clinical need was genuine, the trial results were real, and patients living with a serious, previously undertreated condition gained access to a legitimately new, evidence-based treatment option. At the very same time, the commercial logic behind investing research dollars into precisely this indication at precisely this moment in the medication's patent life cycle was impossible to ignore. In the pharmaceutical industry, genuine medical advancement and shrewd commercial timing frequently arrive tightly wound together, and untangling exactly where one ends and the other begins rarely produces a clean, satisfying answer. Consider what this approval meant to the patients themselves, the people who had spent years navigating a condition frequently misunderstood, sometimes dismissed outright as a simple lack of willpower rather than a genuine diagnosable disorder deserving real medical treatment. For many of these patients, the arrival of the first medication specifically studied and approved for their exact condition represented a meaningful, validating moment entirely separate from whatever boardroom calculations happened to accompany it. Corporate strategy and genuine human relief are not mutually exclusive outcomes of the same decision. They frequently arrive bundled together inside the very same press release, the very same approval letter, the very same small orange capsule now serving an entirely new purpose it was never originally designed around. By this point, the drug had ascended to the rarest air in the pharmaceutical world. It had become a genuine blockbuster, generating billions of dollars in revenue in a single year. The little molecule from Radford was now one of the most commercially important products its parent company owned, a reliable engine of profit prescribed to an enormous and growing patient base. This is the strange alchemy of modern medicine, where a clever chemical idea, if it lands at the right moment with the right story, can transform into an economic force large enough to shape company strategy, executive bonuses, and stock prices. The whiteboard scribble had become a financial titan, and with that kind of money flowing, the drug was no longer just a treatment. It was an asset, a fortress, and a very tempting prize that other giants of the industry were beginning to eye with serious interest. Consider just how rarely any single pharmaceutical product reaches genuine blockbuster status, generally understood within the industry as generating at least $1 billion in annual revenue. Thousands of compounds enter early laboratory development for every single one that eventually crosses this threshold, and the vast majority of promising early candidates quietly fail somewhere along the long, expensive path from initial synthesis through clinical trials and regulatory approval. Reaching blockbuster status is not merely a financial milestone. It represents the successful navigation of an almost absurdly difficult gauntlet, where the odds of failure at any single stage remain uncomfortably high. During these peak years, the medication generated revenue figures that would have seemed almost unimaginable back when a small team in rural Virginia was still nervously waiting on early laboratory results. Billions of dollars annually flowed from millions of individual prescriptions, each one representing a doctor's careful clinical judgment, a patient's daily routine, and somewhere far upstream, that same quiet lysine bond patiently waiting to be unlocked inside a bloodstream. The sheer scale involved is genuinely difficult to hold in your mind all at once, the way it is difficult to truly picture just how large $1 billion of anything actually is. This financial success rippled outward well beyond the balance sheet itself. Corporate strategy increasingly organized itself around protecting and extending this single product's commercial life. Executive compensation, tied as it so often is to overall company performance, became meaningfully influenced by how well this one medication continued performing in the market. Stock analysts covering the parent company built detailed financial models specifically tracking this drug's prescription trends, competitive threats, and patent timeline, treating it as a critical variable in the company's overall valuation. And with success at this scale, inevitably comes attention from elsewhere in the industry. Other pharmaceutical giants, watching from a comfortable distance, began quietly calculating what it might take to acquire not just this single product, but the entire company now built so heavily around its continued success. The modest Virginia molecule had travelled an extraordinary distance, from an uncertain whiteboard sketch to one of the most commercially significant assets in an entire industry, and its journey, remarkably, was still nowhere near finished. It is worth pausing to appreciate just how thoroughly this transformation would have surprised the original small team who first sketched the concept years earlier, back when the entire project existed as little more than a hopeful theory and a stack of unproven laboratory data. Blockbuster status is the kind of outcome every early-stage pharmaceutical researcher quietly dreams about while rationally expecting something far more modest, if anything at all. Watching a molecule you helped design in its earliest, most uncertain form eventually become a multi-billion-dollar annual fixture in medicine cabinets across an entire country must carry a strange, almost dizzying quality, equal parts pride and disbelief, the sensation of watching a small seed you once planted grow into something considerably larger than you ever quite dared to imagine. For all its cleverness, the drug eventually had to face the same test that humbles every confident invention: contact with actual human beings. And humans, as history reliably demonstrates, are endlessly creative. The prodrug design genuinely did blunt the classic forms of misuse, and that was a real achievement. But abuse-resistant was never the same as abuse-proof, no matter how the marketing sometimes made it feel. People still overused it by simply taking more than they should. It still carried genuine potential for dependence. The chemistry had raised the barrier, not removed it. It made the easy shortcuts pointless, but it could not rewrite human nature or eliminate risk entirely. In the end, the drug proved that engineering can meaningfully reduce harm, which is a wonderful and valuable thing, while also proving that no molecule, however clever, can ever fully outwit the determination of the people using it. There is a particular humbling lesson buried inside almost every abuse-deterrent pharmaceutical innovation throughout history, and this molecule was no exception to it. Chemistry can genuinely close specific, well-understood pathways toward misuse, and it deserves real credit when it does so successfully. But human behavior around substances rarely confines itself neatly to the exact pathways engineers anticipated when designing their solution. Close one door convincingly enough, and people do not necessarily give up entirely. Sometimes they simply look for whichever door remains open, even if that remaining door offers a considerably less dramatic, less immediately satisfying experience than the one that used to exist. For this particular medication, that remaining pathway turned out to be the simplest, least glamorous one imaginable. Rather than crushing, snorting, or dissolving the capsule to chase a faster rush, some patients and misusers instead simply took more capsules than prescribed, swallowed as intended, patiently waiting through the same gradual bloodstream conversion, just with a larger overall quantity working its way through the system. This approach never produced the sharp, dramatic euphoria associated with older, immediately active stimulants, but taken in sufficient quantity over sufficient time, it could still produce meaningful psychological reinforcement, meaningful tolerance, and meaningful risk of dependence, all without requiring any of the classic misuse techniques the prodrug design had so successfully closed off. This reality never actually contradicted the underlying scientific claims made during development and approval. The medication genuinely did produce less euphoria and less immediate appeal compared to equivalent doses of ordinary amphetamine, exactly as the original liking effect studies had demonstrated. What it could not do, and what no chemical design targeting a specific misuse pathway can ever fully accomplish, was eliminate the broader, more diffuse human tendency toward overuse, tolerance, and dependence that accompanies any sufficiently rewarding substance, however gently or gradually that reward happens to arrive. Perhaps the most honest way to understand this chapter of the story is as confirmation of both the genuine success and the genuine limits of chemical engineering applied to human behavior. The specific problem the prodrug was designed to solve, rapid, dramatic misuse through crushing and alternative routes of administration, really was substantially reduced. The broader, messier problem of human dependence on a rewarding substance, in any form, at any speed, remained exactly as present and exactly as human as it had always been. There is an important lesson buried here for anyone hoping technology alone might someday fully solve the complicated relationship between humans and rewarding substances. Engineering can meaningfully narrow the specific paths toward harm, and that narrowing genuinely matters, saving real people from real, preventable consequences along the way. But engineering cannot rewrite the underlying psychology of reward and reinforcement that has shaped human behavior since long before pharmaceutical chemistry existed at all. Closing one door firmly and effectively is a genuine, worthwhile achievement. Expecting that single closed door to end the broader conversation about misuse and dependence entirely was always asking more of one clever molecule than any molecule, however elegantly designed, could ever realistically deliver. The story then swept up into a transaction so enormous it made the original $2.6 billion purchase look almost quaint. In early 2019, the pharmaceutical company Takeda completed its acquisition of Shire in a deal valued at roughly $62 billion, one of the largest pharmaceutical acquisitions the world had ever seen. And riding along inside that colossal purchase, among an entire portfolio of medicines, was our familiar little prodrug. The molecule that began as a long-shot idea in a small Virginia town had now been passed, like a priceless heirloom, from a tiny start-up to a mid-sized giant, and finally into the hands of one of the biggest pharmaceutical corporations on the planet. Each transfer valued it more highly than the last. It is a dizzying thought that a single well-designed capsule could sit at the heart of deals, measured in the tens of billions of dollars. The scale difference between this transaction and the earlier acquisition is genuinely worth pausing over. $2.6 billion had once seemed like an almost unimaginable sum for a modest Virginia biotech company built around a single molecule. Now, roughly a decade later, that same molecule formed just one component, admittedly an important and valuable one, within a portfolio valued at more than 20 times that original acquisition price. This is the strange compounding nature of successful pharmaceutical assets, where genuine commercial success does not simply preserve value over time, but frequently multiplies it dramatically, especially as a drug expands into new indications and builds an increasingly dominant market position. For Takeda, this enormous acquisition represented a strategic transformation of its own, dramatically expanding its presence in specialty pharmaceuticals, rare diseases and neuroscience, categories where Shire had built substantial expertise and an impressive product portfolio over the preceding years. The medication our story has followed from its earliest whiteboard sketches represented just one piece of this much larger portfolio, though hardly an insignificant one, given the billions of dollars in annual revenue it continued generating even as it approached its own eventual patent expiration. There is something worth noting about the sheer number of corporate hands this single molecule passed through across barely more than a decade of its existence. Conceived and developed by a small independent company, acquired by a larger pharmaceutical player seeking to solve its own patent cliff problem, then swept up again, this time as part of an even larger acquisition, into the hands of a global pharmaceutical giant with operations spanning continents. Each transition brought new resources, new marketing infrastructure, and new strategic priorities, while the underlying chemistry itself, the lysine bond and its patient bloodstream unlocking, remained entirely unchanged throughout every single one of these corporate transformations. By the time this massive transaction closed, the modest molecule from rural Virginia had become part of one of the largest pharmaceutical portfolios on the planet, its origins as an uncertain, underfunded gamble by a small team of scientists almost entirely obscured beneath layers of subsequent corporate history and staggering financial scale. There is something almost dizzying about tracing a single object's ownership history across a transaction of this size, the way you might trace an old house through generations of different families, each one adding a fresh coat of paint, a new addition, a different name on the mailbox, while the original foundation quietly remains underneath it all. Somewhere inside Takeda's enormous global operation, spanning dozens of countries and thousands of employees, sat the direct descendant of a small Virginia research project that had once operated out of a handful of modest offices along a quiet stretch of river. The scale had grown almost beyond recognition. The underlying chemistry, patient and unchanged, had not grown at all. It remained exactly the same lysine leash it had always been, simply carried now by a considerably larger set of corporate shoulders. So here we are, at the quiet end of a very long, very strange story about a molecule that spent years pretending to be nothing at all. Let your shoulders sink a little further into the mattress now, because there is nowhere left to go tonight except gently, gradually towards sleep. But before the lights go all the way out in your mind, let's drift back over everything. This small, sleepy little compound actually lived through, the way you might flip slowly through an old photo album in the dark, no longer trying to remember every detail, just letting the shapes and colours pass by one more time. Picture, if you can, that first quiet frustration sitting inside the pharmaceutical industry for decades before any of this even began. A whole family of medications that genuinely helped people, and yet carried the same tired, stubborn flaw everywhere they went, ready to be crushed, dissolved, and misused the moment somebody decided the packaging was more of a suggestion than a rule. Doctors worried, parents worried, an entire industry quietly worried, the way you worry about a loose stair tread you keep meaning to fix and keep somehow never getting around to. Nobody had found a way to fix it properly. Not yet. Now picture amphetamine's own long, tangled history stretching out behind all of that worry like a shadow nobody could quite outrun. A forgotten chemical curiosity from the 1880s, shelved and ignored for decades until somebody stumbled onto its restless, wide-awake personality by accident while looking for something else entirely. A miracle inhaler, a wartime companion handed to exhausted pilots, a campus secret passed from student to student, a public health scare, a regulated medicine. One single molecule wearing an almost dizzying number of different costumes across more than 100 years, each one a little more cautious than the last, each one still carrying just a little bit of the same old restless energy underneath. And somewhere inside that long shadow sat Adderall, wildly popular, deeply profitable, and quietly nervous about two very different kinds of trouble, creeping up on it at once. Misuse chipping away at its reputation in schools and dormitories, patents chipping away at its financial future in boardrooms nobody outside the industry ever sees. It is a strange thing to imagine, a multi-billion-dollar product feeling vulnerable, and yet there it sat, successful and exposed all at the same time, waiting for whoever might solve both problems first. Now let your mind drift somewhere quieter, somewhere far from the glass towers and marble lobbies you usually picture when you think about big pharmaceutical companies. Picture a small town called Radford, tucked into the gentle hills of southwestern Virginia, sitting along a lazy winding river. Picture a handful of unglamorous offices, coffee going cold in paper cups, a whiteboard covered in molecules nobody outside that room would ever recognize. This is where the whole strange idea actually began, not with fireworks, but with quiet, patient stubbornness. The idea itself was almost embarrassingly simple to describe once you say it out loud, even though it took years of careful science to actually pull off. Instead of handing the world an amphetamine that was ready to work the instant somebody touched it, build one that was fast asleep. Attach it gently to an ordinary amino acid, the same harmless little building block sitting quietly inside the eggs and beans on your dinner plate, and let that pairing act like a soft leash, holding the whole thing still. No coating to crush, no bead to grind, just a sleeping molecule, waiting patiently for the one process capable of waking it up. And that process, remember, was never some elaborate laboratory machine. It was your own bloodstream, the same tired, faithful red blood cells that spend their entire quiet lives carrying oxygen without ever asking for recognition, now handed a second job nobody had ever asked of them before. Snip the leash loose, slowly, steadily, at exactly the same patient pace, no matter who was in a hurry and who was not. You cannot bribe a red blood cell. You cannot threaten it into working faster. It simply keeps doing what it has always done, unhurried, unbothered, entirely indifferent to anyone's intentions. This is why crushing the capsule stopped working, why dissolving it, snorting it, or trying any of the old familiar shortcuts revealed nothing new underneath. The shortcut everyone had relied on for decades quietly stopped existing, not because somebody built a stronger wall, but because there was nothing dangerous sitting behind the wall in the first place, only a patient, dormant molecule waiting for biology to take its own sweet time. Years of careful testing followed, the unglamorous kind nobody ever puts in an exciting movie. Blood samples, spreadsheets, endless graphs quietly confirming again and again that the molecule behaved exactly as promised. Then came the real trials, real children, real families filling out symptom questionnaires week after week, watching afternoons grow calmer and homework grow a little easier. And then came the strange, almost uncomfortable studies asking volunteers how much they actually enjoyed the experience, turning pleasure itself into something that could be measured, charted, and compared. Less euphoria, less rush, less appeal to anyone chasing the wrong kind of feeling entirely. By February of 2007, after years of hope and setbacks and sleepless nights, the little molecule finally received its approval and its real name, and almost immediately the world reminded everyone involved that cleverness does not erase caution. It still landed in the same tightly controlled category as every stimulant before it, a firm, sensible reminder that lower is never quite the same thing as none. Then came the money. $2.6 billion, arriving almost as quickly as the approval itself, as a much larger company swooped in and quietly solved its own looming crisis by purchasing someone else's patient decade of work, and later, an even larger sum still, $62 billion, folding this same small molecule into one of the biggest pharmaceutical portfolios on the planet, its humble Virginia origins buried now beneath layer after layer of corporate history, and staggering financial scale. It grew up, this molecule. It left its narrow beginning behind and expanded into new territory nobody quite expected, helping adults and eventually helping people struggling with binge eating disorder too, becoming something close to a household name recognized across generations. It became, for a while, one of the rarest things in medicine, a genuine blockbuster, generating billions of dollars every single year. Its quiet lysine leash working the exact same unhurried trick inside millions of bloodstreams all at once. And then, right on schedule, the way every such story eventually must, its patent protection quietly expired, and cheaper copies flooded gently into the market, prices falling just as the whole system is designed to make them fall. The very same fate this molecule had once been purchased to help someone else escape, arriving finally, patiently, for itself. So what do we make of all of it? Lying here in the dark with your eyes growing heavier and your breathing growing slower? Perhaps only this: that cleverness is real and worth admiring, and also never quite the whole story. A team of ordinary, stubborn people looked at an old, tired problem and found something genuinely new to say about it. Not a miracle, but a meaningful, honest improvement, wrapped, as these things so often are, in slightly more confident language than the fine print technically allows. There is something quietly comforting in that thought, actually, now that you sit with it a moment longer. We rarely get miracles. We mostly just get people trying hard, failing sometimes, succeeding sometimes, and slowly, patiently, making difficult things a little bit better than they used to be. That is not a small thing. That is, in its own quiet way, most of what progress has ever really looked like. Whether we are talking about medicine or nations or any of the small stubborn improvements ordinary people manage to make while the rest of us are busy sleeping. So as you lie there now, wrapped in whatever blanket you have pulled close, safe and warm and comfortably unbothered by any of tonight's chemistry, let yourself simply appreciate the strange, quiet miracle of your own unremarkable body doing its unremarkable work in the background, the way it always does, without needing your permission or your attention. Your lungs breathing slowly, your heart keeping its own patient, unhurried rhythm. Nothing dramatic happening in there tonight, nothing needing to be unlocked or released or measured on any chart at all. Just rest, plain and ordinary, doing exactly what rest has always done, long before any laboratory ever tried to improve upon it. Let the story of the little molecule from Radford fade now, gently, the way all of tonight's stories eventually fade into something softer and less defined. No more whiteboards, no more billion-dollar acquisitions, no more red blood cells quietly working the night shift. Just the dark, familiar room around you, the soft hum of whatever fan or white noise is keeping you company, and the slow, heavy pull of sleep finally arriving, right on schedule, exactly the way it always does, needing no clever chemistry at all to find its way to you tonight. Sleep well, and we will see you next time for another quiet, sprawling story whispered gently into the dark.